Don't ignore coughing as it can be COPD. Coughing is common, but if you cough continuously and have other symptoms, such as chest tightness or shortness of breath, you should be aware of COPD. What is COPD? Chronic obstructive pulmonary disease, COPD, is a common, preventable, and treatable chronic lung disease characterized by persistent airflow limitation and other respiratory symptoms. According to WHO, COPD was the third leading cause of death globally in 2019. Symptoms of COPD: shortness of breath, wheezing, chest tightness, chronic coughing with sputum, frequent respiratory infections, lack of energy, unintended weight loss, swelling in ankles, feet, or legs. Causes of COPD. At present, the main cause of COPD is long-term smoking. Long-term inhalation of occupational dust and chemical gases will also increase the risk of disease. Moreover, genetics, age, gender, socioeconomic status, asthma, chronic bronchitis, and infections are other factors that can affect the onset or exacerbation of COPD. Treatments for COPD. Treatments for COPD generally include lifestyle changes and medications. For people with mild COPD symptoms, the most effective way is to quit smoking and avoid occupational dust and gas exposure. Medications include bronchodilators, corticosteroid, and sometimes antibiotics. However, these medications need prescription and must be used under the supervision of a doctor. MicroGen for COPD. HeaWea MicroGen is an advanced frequency healing device that can transfer positive energy into your body to improve COPD. We recommend the following programs. The TENS pads should be placed on your right shoulder and below your right rib cage.